even you may have other stakeholders involved and who are your partners or companies you're working with. They may think that they know what they want, but until they actually get the product into the hands of the user, they're not actually sure whether that's going to be, and they may end up changing a few things. Has this been your experience?
Yeah, I can tell you. So this is, I mean, obviously going back, it's one of the trends that we've seen. There has been, I mean, so we work mostly with pharma and medtech companies, right? So there have been a lot of failures. I cannot tell you, like the first few times after I had switched roles, so after I came into this, the first few times, it was very shocking for me to see the attitude from some people, right? The attitude from some people was, we've done this in the past, it doesn't work, right? I've launched so many apps and none of them work. And it took me a while to realize, actually, the first time that happened, to get to the point where it's like, yeah, but so why didn't it work, right? Like, describe to me the solution, and you get like this feeling of like, seems convoluted, seems like a difficult app. I don't know if I would use it. So then the question comes like, okay, what did the physician say that you tested this with? What did the patient say? Like, how did you like, oh yeah, that would have been too complicated, so we didn't include them. Like, well, there's your answer.
That's your answer, exactly.
That's not how you do it. So the trend has been to go more into the direction, obviously, of exactly what you just said, right? And our partners are very well educated in that space, right? And are very, like, we look for these because, as we said, we want to make solutions successful. So that it needs to be also driven internally on their side, right? And that is not something we have too much control over. So the understanding of how do I launch this? What is my impact? I think that's what we work a lot with our partners and sort of helping them understand what we can do, what we can measure, and what we can do in terms of improving the product and making sure that it is used. There are some question marks that are always coming up that, quite honestly, we need to do. But there's also some very, 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 very smart people working on sort of these aspects that make sure that whatever we launch, whatever we can launch, gets to the market as validated as possible, to make sure that a hypothesis of what is the value proposition that we're trying to deliver to healthcare here, right? What are we trying to change? That is sound, and that works, and that we can make sure, or that we can be confident that that solution will find uptake, and we actually get to the point where we can test and we can do that, right? Because a lot of the early sort of discussions was, well, fundamentally, if you design a bad app, you know that, I know that, right? You download an app, I think the general open rate of apps that are downloaded is already scary low, right? So you download an app, and I would be shocked if it's more than 1 in 2 that is being opened for even once. And I've observed myself when I test new apps for a new area, right? There could be several things. There is a drop off within seconds, right? Within seconds, you look at the app and you're like, nope, not for me. Nope, I don't want to do that. Nope, I don't want to do that, right? So the time you get to test, that is super critical. So what you need to make sure is, when you hit the market, that you actually can get users in, and that these users start using your application, right? If you think of one of
You need to
the,
be able to see how you can improve engagement, how you can maintain engagement, how you can get people
exactly,
back. Engagement is the name, is the word here, right? Exactly.
100% agree. And I think, so if you go follow Nir Eyal's hooked method, right, for like habit forming products, be they good or bad, right? But if you look at that, I think he had a very good quote, and that is, you need 5% of your users to be using the product like you anticipate. If you can get that, you can build a really successful product. 5%. That's not that much, but you know, a lot of people still fall short on that. And that's the one that we work with, right? So with our partners as well, we work on, okay, what's the hypothesis? What can we do to create a user base of which we can get, and we actually then hire 5%, but of which we can get 5% to use the product like we wanted to use it, and then focus on how we can grow that.
Thanks for watching, and I appreciate you as a valuable viewer. And if you liked this segment, you can watch all of the different individual segments or the whole podcast to have a broader understanding on this topic. Just check the links in the description or what you see on the screen right now. I'm Dr. Umer Khan. Looking forward to seeing you again. Thank you.